My name is Laura Otieno. I'm a midwife from Dholuo. I have been doing this kind of work since 1980. I learned this skill from my grandmother. I used to admire how she was massaging pregnant women, and she called me in one day and told me to learn the skill so that one day it might help me secure a livelihood for me in future. When a woman comes to you, the first thing you consider is whether the baby is kicking. If it is kicking, then you are safe. But if not, then we call for an ambulance. Sometimes you can have a stillbirth, which you best identify through how the blood flows. Very red blood indicates that there is a problem. The main challenge here is there is no pay, because sometimes the women come here and complain that they do not have money, and because you cannot turn away, then you help her and she pays you whatever she can afford. Sometimes it will be 1 bar of soap, not something you can use. I would love for the government to try and get us piped water and also set up a proper house where I can help these women from.
Before I gave birth, I used to come here for the birth attendant to massage my stomach. She used to massage me very well, that when I left this place, I had no pain. She's very wise and skilled. I chose to deliver my second baby here because I did not have money. Besides that, I really liked and enjoyed her services. If I am being honest, she's way friendlier than the nurses in the hospital.
If there's one thing we learned from COVID-19 pandemic, is the need to strengthen primary healthcare, and people like traditional birth attendants are very key, because if we are to attain zero maternal deaths, then we must take them into account. Of course, there's a risk of infection, due to poor hygiene, and also the risk of fistula among women. So that's why we need to look at capacity building. Instead of burying our heads in the sand, let us embrace them and see how we can work out a win-win formula, because really the end goal is better maternal care for all.